start with ovarian pathology. Our objectives will be understanding the normal histology first. Then we're going to classify the ovarian tumors. We'll read about the morphology, which includes the gross and the microscopy, along with the clinical features, and then the management. And what is important for you in the end? What are the high yielding exam concepts? Right. So we'll start with the overview. You should know that ovary has a dual function. It has a reproductive as well as the endocrine function. Am I audible?
Yes, ma'am, you are audible but not visible. But no issues, you can start with the line is going on.
So we know there are parts, different parts of ovary. We have cortex, we have medulla. So the cortex is composed of follicles and the medulla is composed of vessels and stroma. Right, so this is the normal histology which you see. You can see the surface epithelium there, the lining epithelium, the cuboidal epithelium on the top. Then there's tunica albuginea. Then there are follicles in varying stages. So you have a primordial follicle, which develops into primary follicle. You have a secondary follicle, and so on. And then it ends into a corpus luteum. So when you say it's a low grade type, there has to be little calcification and papillary growth is there, but the nuclear atypia is not that pronounced as much as in high grade. So it is on the basis of atypia you can decide whether it is a low grade or a high grade, how much crowding is there, how many glands are there, papillae, micropapillae, all these patterns can be seen. Now if you see high grade, look at the difference. It is striking in your eyes so much because it is the stark atypia, nuclear atypia, which you can.
Silent, aggressive, and often detected too late. High-grade serous carcinoma, the most common and deadly ovarian cancer. It usually begins in the fallopian tubes, not the ovary. Driven by TP53 mutations, it spreads rapidly across the abdomen. Symptoms are subtle: bloating, pelvic pain, early satiety. Most patients are diagnosed when it's already advanced. Treatment involves surgery and platinum-based chemotherapy. New targeted therapies like PARP inhibitors are improving survival. Early suspicion saves lives. Stay aware, stay ahead.
If anyone have any doubts, they will ask in the end of the session, so you can continue with the class.
Okay. So mature will have all the germ layers present. So you'll have the epithelial component, right? You can see any bronchial lining epithelium. Then you can see hair follicles. You can see sebaceous glands, right? And in immature teratoma, you'll see the neural component. That means it is an immature neural epithelium which is present in some way. So again, I explained this already. Coming to dysgerminoma. Dysgerminoma is seen in younger females. It has a good prognosis. You can see that these cells are there, right? It looks like a seminoma of testes. So you have something called as fried egg appearance. You see those cells here? Clearing is there in the cytoplasm, and only thing you can see is that nucleus is there, blue thing, and around that there is empty space and the cell membrane. So that is called as fried egg appearance. So centrally placed nucleus and the membrane and the prominent nucleoli will be there. And the fibrous septa in the background. So this looks like a seminoma. You do an IHC for it. Now germ cell tumors, you mainly do OCT4, CD117 and PLAP. All these will be positive. Yolk sac tumor, I told you AFP is elevated. What you see stark feature here is Schiller dual bodies. You can see that there's a central vessel there which is labeled. Around that you see, around the lumen you'll see tumor cells. The hollow spaces around those tumor cells. So that is called as Schiller dual bodies, which is characteristic of yolk sac tumor. Now, yolk sac tumor can have a lot of patterns. It can have a glomerulide or reticular pattern. It can have a papillary pattern. Okay, it can have macrocystic, microcystic, any kind of pattern can be seen. So, what you need to see is Schiller dual bodies, the
Silent, aggressive, and often detected too late. High-grade serous carcinoma, the most common and deadly ovarian cancer. It usually begins in the fallopian tubes, not the ovary. Driven by TP53 mutations, it spreads rapidly across the abdomen. Symptoms are subtle: bloating, pelvic pain, early satiety. Most patients are diagnosed when it's already advanced. Treatment involves surgery and platinum-based chemotherapy. New targeted therapies like PARP inhibitors are improving survival. Early suspicion saves lives. Stay aware, stay ahead.